Welcome back to the Racing Mind video series, where we journey deeper into the human mind than anyone has ever gone before. In this video series, we untangle the ancient mystery of mental illness and teach you what you need to know before your racing mind gets the best of you. This groundbreaking series provides answers to some of the deepest mysteries of the human mind and reveals, for the first time in history, the precise cause of mental and emotional illness and the psychophysiological basis of a wide range of psychiatric disorders and associated medical conditions. These educational videos, which present concepts that are so new that they are just beginning to make their way through the medical field, are based on thousands of hours of direct patient analysis and clinical observation in conjunction with the latest research on psychiatric disorders from around the world. In this segment of this series, we will discuss post-traumatic stress disorder in relation to neuronal hyperexcitability. Also known as PTSD, post-traumatic stress disorder classically involves vivid memories, flashbacks, and nightmares about an event that the average person would consider to be highly stressful, such as a severe automobile accident, a sexual assault, or an armed robbery. What distinguishes the disorder from a normal response to a traumatic event is the persistence of symptoms long after the event has taken place. Why some persons continue to relive the trauma months or even years after the event has heretofore remained unclear. However, a groundbreaking new hypothesis suggests that PTSD, as well as a wide range of other psychiatric disorders, is caused by an abnormal amplification of electrical signaling in the brain. According to the multi-circuit neuronal hyperexcitability hypothesis of psychiatric disorders, some persons are born with an inherent hyperexcitability of their neurological system. Hyperexcitable neurons fire more easily and for longer periods of time than normal active neurons. Hence, when a traumatic event is experienced, the hyperexcitable neurons abnormally amplify the intensity of the experience and abnormally extend the duration of the experience. As a result, traumatic experiences that would seem relatively minor to others may seem relatively major to the person with hyperexcitable neurons. Also, because hyperexcitable neurons take longer to settle down, the stressed mind, which itself provokes the neurons to fire, continues to experience the trauma until the vicious cycle of mutual overstimulation between the mind and the brain comes to an end. For persons with a high level of neuronal hyperexcitability, that could take quite a bit of time. The idea that PTSD is rooted in an inherent hyperexcitability of the neurological system is supported by the observation that a large proportion of those who develop PTSD have a prior history of other psychiatric symptoms such as difficulty sleeping, generalized anxiety, recurrent depression, panic attacks, or attentional difficulties. For some, these symptoms may be very subtle or may not even be present until the traumatic event occurs. That's because the hyperexcitable brain is like a hive of irritable bees. Until something disturbs the hive, the irritable bees may remain completely indistinguishable from normal bees. Although behavioral and psychological techniques can be very helpful in treating PTSD, the most effective approach is to directly reduce the excitability of the neurological system. When combined with cognitive and behavioral treatments, this can markedly reduce the time needed to bring to an end the vicious cycle of mutual overstimulation between the mind and the brain that keeps refueling the symptoms of PTSD. Reducing the excitability of the neurological system can also reduce or eliminate the various other psychiatric symptoms that many persons with PTSD struggle with. The most effective natural ways to compensate for the gene abnormality that underlies neuronal hyperexcitability include stress reduction, establishment of an early sleep schedule, regular exercise, enjoying a relaxing hobby, avoiding caffeine and other psychostimulants, and minimizing refined sugar. If these interventions are either too difficult to implement or fail to yield satisfactory improvement, then treatment with neuroregulators and other brain calming medications may be necessary. Neuroregulators are favored over antidepressants because they are faster acting, have fewer side effects, and avoid the stimulatory effects of antidepressants. They are also favored over antipsychotic drugs because they avoid the sedating effects of antipsychotics, as well as the partial stimulatory effects that some antipsychotic drugs have. Control your brain, control your life. We hope that you are benefiting from this video series. Portions of this video and others in this series were taken from the books The Racing Mind and Am I Depressed or Am I Bipolar? Those interested in developing a deeper understanding of this topic can also refer to the scientific publication, The Multi-Circuit Neuronal Hyperexcitability Hypothesis of Psychiatric Disorders. Please note that these materials in this video series are for educational purposes only and are not intended to guide treatment without formal evaluation. This video series is sponsored by the Binder Foundation, a charitable organization that is dedicated to the enhancement of human life through research and education on disorders of the mind, body, and spirit. If you have found this video to be a benefit to you, please share it with your family and friends. And please don't forget, your feedback is important to us.